My name's Donna Martsolf. I'm the Associate Dean for Research and Translation here at the UC College of Nursing. I've been here for about a little over a year and a half.
Okay. And what is your area of advanced practice nursing?
Okay. Well, I'm a psych nurse. I'm a psych nurse through and through. I lasted about 3 months in med-surg in orthopedics and neurosurgery and rapidly figured out that was not my area of clinical interest, and moved to psych just a few months out of my undergraduate education, and I've been there ever since. So that's been over 40 years.
Over 40 years in psych mental health nursing?
Yeah, as a staff nurse, as a head nurse, what used to be called head nurse, essentially a clinical manager, unit manager, and then I did my master's degree and became an advanced practice nurse, and I had all sorts of different experiences as an advanced practice nurse, and then got my PhD and moved to a faculty role as a researcher.
Can you tell me about some of your roles and responsibilities as an advanced practice nurse?
Sure. As I said, I started out as a staff nurse right after I graduated from my bachelor's program at the University of Michigan. This was in the early 1970s, and back then it was a really big deal to have a bachelor's degree. There weren't too many nurses with a bachelor's degree, so less than a year out of my undergraduate program, I was the unit manager on an inpatient psychiatric hospital in a large teaching hospital in downtown Philadelphia. And nowadays, there is no way that would ever happen. Of course, I didn't have enough experience and all sorts of things, but I did have this bachelor's degree that prepared me really to be a leader, and I learned a lot. I learned a lot. Fortunately, I had great mentors. They were advanced practice nurses, and as I was working with them as a head nurse, and this unit was a locked unit, we rarely had an admission that wasn't someone who'd been brought in by the police. These were people who were floridly psychotic for the most part, either with schizophrenia or bipolar disorder, and we served a catchment area of South Philadelphia, which is a pretty rough area, and so I learned very quickly how to manage very, very ill mental health clients. And at the time, we had very few medications. I gave the first shot of Prolixin that had ever been given at that hospital, and so we basically had Thorazine and Elavil and Formaldehyde, and that's what we dealt with. And so I learned a lot of skills about managing patients. But what I came to realize for these advanced practice nurses who were my supervisors, I thought they were brilliant. They're just amazing. I don't know how they know all this stuff. So I decided to go back to the University of Pennsylvania to get my master's degree because it was just down the street, and that's where they had gone, and I figured somehow they got to be brilliant. I wasn't sure how it happened, but once I got there, I realized that what had happened is they'd gotten a master's degree, and they had just learned a lot of things in their master's program, which then I went to learn as well. And so that really prepared me after I completed the master's degree to enter really any area. Back then there was not the NP role because this was 1975, it had just started, and the psych advanced practice degree really was an NP role as it was conceived in the 70s. And so I was able to make diagnoses and treat. We didn't have prescriptive authority at that time, but we were able to do psychotherapy. And my first job out of my master's program was at the same hospital where I'd been a head nurse, but instead of being on the mental health units, I was on consultation liaison. So I was given about a third of the units in the hospital. I had oncology, ICU, NICU, orthopedics. I had a whole array, probably about 8 or 10 units, where I consulted. So I would make rounds with a psychiatrist and on patients who were in med-surg settings and definitely needed mental health, primarily medications. But when I would go with the psychiatrist, and then I would work with the nurses to learn how to manage those individuals in the med-surg setting who normally would have been in psychiatry but had whatever situation was going on medically or surgically with them. I also was consulted by the nurses directly. If they had a patient who maybe didn't need psychiatry, but with whom they were just struggling and trying to manage them, they would consult me, and I would come and help them manage those clients. I actually did see some clients individually in therapy, and kind of in informal therapy, and then it came to the point where the surgeons started consulting me and asking me to come and talk with some of their clients who maybe had, for example, in orthopedics, had lost a limb traumatically, and I would come and talk with them and try to help them deal with some of the grieving that went along with those kinds of things. So that was my first job with the Masters. Then I went and moved to an area, we were relocated as a family, and there was a small community hospital there. It actually was the hospital where they took the Cute Creek miners when they were trapped in the mine. Afterwards, they took them to this regional hospital, and that's the hospital that I happened to be at earlier. And in that community hospital, I was the first nurse with a master's degree, I believe, if I remember correctly, in the hospital. And in addition to that, I was one of the very few who had not graduated from that particular hospital school of nursing. So there, my role was very, very different. I worked directly in the psychiatry units to help the nurses. They had brought in a new psychiatrist, and he was wanting to really work more collaboratively with the nurses, but the nurses really hadn't been in that kind of relationship with the psychiatrist before. So the director of nursing hired me to come in and work with the nurses in psychiatry to upgrade their practice so that they could practice more collaboratively with the psychiatrists. I was there for 3 years, and our family was relocated again, and at that time I joined a psychologist and did outpatient clinical psychotherapy, both groups and individual psychotherapy, in an outpatient setting for about 7 years. And so that's kind of the background that brought me then to the place where I got my PhD, really got turned on to research, and then it was very logical to do my research in areas that had to do with mental health. So that's where I am today, in a faculty position doing research.